My name is David Duffy. I am a retired internal medicine doctor. I am taking the opportunity to share some thoughts that I have about healing the body. I graduated from Harvard Medical School in 1971. I had my medical internship and residency at Montefiore Hospital in the Bronx, New York. I worked at that hospital until 1980. I spent 8 years in private practice in California. I returned to New York and worked at Metropolitan Hospital in New York City until 2006. And then from 2006 to 2013, I had a private practice in Astoria, New York. And over that period of time, I was interested in having patients participate in their own care. In California, I had a patient who came in. He had very high blood pressure. He required 3 medications to control it. And we did our complete history and physical, and I was pretty straight with him. I said, hey, you weigh 260 pounds. I said, really to get your blood pressure down, you're going to need to lose weight. So he was supposed to come back in a month or so, and he didn't show. Oh my goodness, I was too hard. I pushed him too hard. I embarrassed him. I don't know, better be careful. About 6 months later, I hear the bell ring. The patient comes in. Oh, hey, where have you been? What you been doing? He said, I did what you told me to do. He had lost 80 pounds. His blood pressure was perfectly normal, and he no longer needed medication. And I called him, you participated, you did that, you proved that worked. You're a medical research associate. In modern medicine, our model is to make a diagnosis with appropriate history, blood tests, x-rays, and treat that condition with medication designed to make the patient feel better. That makes sense. That's, quote, the scientific method. When we graduate from medical school, we take an oath called the Hippocratic Oath. And it says, first of all, do no harm. But Hippocrates, who was the father of medicine, he lives around 500 BC, he had some other observations about health and healing. He would examine a group of patients every day until their illness resolved or they died. And he found that the typical patient would go through a series of symptoms. They had a fever, they had a cough, they coughed up phlegm, they had diarrhea, they had vomiting, they had menstrual bleeding, they had a rash, whatever it is, they went through this and got better. And he said, you get better with healing crises. On the other hand, patients who did not have symptoms did not get better and often died. So what does that mean? It means that we need to let nature go through a process of healing that's determined by the body. But in modern medicine, our model is to use medication to suppress the symptoms that make the patient get better. Therefore, what happens is in modern medicine, we are helping the patient feel better, but they stay sick. We are not helping them heal. We are making them comfortable to minimize the symptoms and suppress the illness. So what happens is that a person can do very well with diabetes, hypertension, lupus, arthritis, asthma, things like that. And they can stay well as long as they take their medicine. If they stop their medicine, they get sick. So we're suppressing the symptoms, we're helping the disease, we're treating you, that's fine. But basically, people in our system, they felt better, but they stayed sick. In the late 1800s and early 1900s, there was a German man named Arnold Ehret. He wanted to be a doctor, but in the middle of medical training, he got kidney disease and was sick. They found protein in his urine. And the German doctor said, "Oh, you're losing protein. We need to give you more protein." And when they gave him more protein in his diet, he got worse. So he left Germany, went to Italy, and then it ended up in Algeria, and spent time. He went with a friend, and they spent time following what they thought intuitively their body needed. They read in the Bible that fruit will be your nourishment. So they had fasting. They had a fruit, basically a fruit diet, and he got better. At that point, doing this with his own experience, he did more research and developed a system called Arnold Ehret's mucusless diet healing system. If you eat cheese, bread, crackers, oftentimes your body makes mucus. So the foods that make mucus, he cut back on. The food that got clean, he increased. And that was the basis of his diet. Now, to be perfectly honest, his concept of physiology was wrong. He had notions about the body that were incorrect. But deep down inside, he had the right idea of cleaning, rinsing out the body. Modern treatment of kidney disease is called dialysis. When a person has less than 10% of their kidney function remaining, and they will not live with the waste building up in their system, they have a extra blood vessel put in so that they can take the blood out into the dialysis machine and rinse the blood and then have it come back into their system. And they will do on the dialysis for 3 or 4 hours, 3 times a week to be maintained their life. Okay. And then, you know, they're, you know, that it really helps. They're removing the urea and the waste, and they're taking off fluid and keeping them in balance. And you can do quite well on chronic dialysis. What Ehret had discovered was what I call dietary dialysis. In dietary dialysis, you're basically cutting down on concentrated foods like meat and potatoes and bread and cheese, and having enough fruits and vegetables so the natural water in those flushes out your system. You are allowing the body to get rid of whatever excess it has. In my practice in Astoria, I had 1 or 2 patients with kidney disease, and it is true that when those patients altered their diet in the direction that Ehret recommended, their BUN and creatinine did go down. There was a dialysis effect from the diet. In the 1960s, a California doctor named Henry Beeler wrote a book called Food is Your Best Medicine. He also had studied Hippocrates, and he himself had high blood pressure and some kidney problems and stuff like that. And he basically had a variation of Arnold Ehret's approach, and eventually treated patients, you know, with, he would help them, you know, take a yeast broth, you know, he had various techniques. Okay. In 1980, there was a professor of nutrition at Cornell University in Ithaca, New York, named Colin Campbell. And he was doing research on nutrition. And a visitor from China came and told him about a study of cancer prevalence in China. The premier, Zhou Enlai, got cancer. And he, because of his own personal interest, asked the Census Bureau to go throughout the country and take a census on how many people have cancer, okay? And so they did that, and in Beijing and Shanghai, you know, there was a high incidence, and over here in the countryside where the rice was grown, there was a very low incidence. And when Colin Campbell said that, wow, look at that, you know, practically no cancer here and a huge amount of cancer there. We need to do some research on this. So so he organized a group of scientists from Britain and United States. So they went over and did the China study. And they found that when they went to a village, they would interview the patients, they would do some measurements in terms of their blood cholesterol, their weight, and all this kind of stuff. They would detailed analysis of their diet. And they found that the patients had what we would call a whole food, plant-based diet. They were not eating any processed foods. They living off the land. They had their soya beans, they had their fruits and vegetables and their rice. And the amount of animal protein that they ate was minimal. It was really they used animal protein, the animals, for flavor and not the bulk of their diet. And their typical cholesterol was like 130, and they had minimal. They didn't have heart disease. They didn't have cancer. They were very healthy. Out of that book comes a recognition that on a long-term basis, moving toward a whole food, plant-based diet makes sense. But again, who's going to do it? Who has the motivation? All that kind of stuff has to be individualized. Okay. Now, from my point of view, I believe that as we get older, there is an accumulation of waste that builds up in the body. I call that biological clutter. Okay, when a person eats a lot of starch, okay, you have your donuts and you have your bagels and you have your cereal and ice cream and all those kind of things. You, hold on one second, we're gonna plug this in. There you go. Your body receives a load of starch, sugar, but it's a processed food like white flour. And as that food comes in, if it doesn't have the thiamine, it doesn't have the balance that it's intended, your body says, well, what do you want to do with this? And some people will say, oh, that's waste. And then they put it somewhere and they have a lot of mucus come out. Another person will say, well, where do you want to put this? This is not usable food. Oh, put it over here. And the person starts gaining weight. They become obese. Another person eats this kind of thing and the body says, well, where do you want to put it? Okay, and they put it in the skin and the person gets eczema. In other words, the body needs to get rid of this. It's not usable. And we, over time, accumulate waste in our body. Women, after menopause, will have accumulation of lumps in the breast. They'll have an accumulation of waste in the uterus and get fibroids. Men will enlarge the prostate. We get deposits of waste in inflammation in the lungs, and we have asthma or chronic bronchitis, you see. What we want to do is analyze each individual and invite them to participate in doing research to find out what is best for them. In this model, we recognize that everybody's different. There are similarities, but we're not identical. We want to help each person attain their ideal metabolism. Because we're imperfect, we're not going to achieve a perfect metabolism, but we do the best we can. How do we do that? If you have a child of diabetic parents. And the parents are overweight. They're taking diabetic pills or insulin. What are we, how can we deal with this child? Is this child filling up on junk food? Is the child obese at the age of 7? Is this child going to get diabetes in another 10, 20, or 30 years? Wait a second. The parents of a child should be very intelligent about controlling. They should be tailoring the child's diet in a way that is in balance with the body so that they don't get obese. They're not filling up on junk food. This is the kind of process that we need to do. I call it self-reliant medicine. Next time we will continue this discussion. At this point, I want you to think about how does my diet reflect my body's needs? How much food do I really need? And what is the direction that I should do in terms of my health pattern?